Here is an overview of Module 2 N120. Some things covered in this particular module. It's kind of a shorter module. First is going to be culture. It's really looking at the norms of a particular group that may guide their behavior. We want to look at dynamics, learned way of life. How can we be a better nurse to people and be able to individualize care? We are all very, very different. Getting to know ourselves and understanding our own culture as well as others is fundamental in providing competent nursing care. So remember that, though, that if you ever have questions about culture, in your exams, think about that as your response. Understand our own culture as well as others, because that's what's most important, is to understand that we are all a little different. I like to focus on these two words, emic and etic. It really looks like the insider's viewpoint, our own person's perspective of a particular culture. We all have an emic viewpoint because we all have a culture, and then we have an etic viewpoint to to other people's cultures. So you're going to have an outsider's viewpoint on how things are perceived. So those are really good terms to keep in mind. It kind of gives some substance to a big topic. Environmental factors. Your discussion question this week is going to focus on environmental factors. So we want to look at all of those things that influence a healthy environment: air, water, food, homework, politics, economy. Looking at environment, toxins, indoor air, tobacco smoke, asbestos, radon, fungus, spores, bacteria, carbon monoxide, formaldehyde, pesticides, asthma, lung disease, premature health. All of these are sources. Environmental, tobacco smoke is probably one of the biggest couple, along with asbestos and radon are going to be three big things that come up in environment. But when you think environment, think bigger things. Think about, what kind of life environment do people live in? Do they have a safe environment? And there's a lot of different ways to look at environment. I went ahead and threw radon in here too. I really narrowed this PowerPoint slide deck down to the big ones. Gases, volatile, pesticides, cleaners, all of those things for environment. But when I think environment, I also think of, what kind of world do we live in? What kind of space, what kind of physical, psychosocial environment, because environment really is what makes a person part of, what makes a person an individual and why they choose to make, certain choices, health choices that can either put them in danger or make them healthier. So, it's who we live with and that just really makes us who we are. So holistic care, we want to look at holistic healing. Every single one of us comes to every point in our life because we are who we are, and we are holistic people. We have pasts, we have futures, we have families, we have feelings, and a nurse cannot just treat a cut on their hand. We really have to understand, did this person go through a trauma in their past that maybe they saw a terrible cut and they're more traumatized than they are now. So we really look at everyone as a big picture. So also we want to look at healing, not just as far as medications. We want to look at mind, body, spirit, connection of everything. There is a specific module that Deb Disney created that is embedded into this module, and there's a quiz linked to that, so you'll want to view that. It's a very, very short quiz. I just think it's 3 questions, but it's a fantastic video, and it really kind of helps put together what our triggers are, how our responses can, how impacts things that impact us, how we respond to that, and stressors and all of those sorts of things come together. What is a nurse healer? We really look at being patient-centered. We want to empower our patients to make decisions. We want to have that nursing presence. We really want to be there as a nurse healer, as our presence, as opposed to just the physical things we do. The nursing presence is incredibly powerful. Complementary methods, things that can complement medication. So maybe we give them a Tylenol, but also in addition to that, love healing, aromatherapy. So much is out there about aromatherapy, herbs, meditation, pet therapy. Like we have therapy dogs that can come in. So it's not all just medications. It's not all that heavy duty clinical stuff. There's really a lot more that goes into that. So you'll find that in your reading. So a reminder on some things that are due this module. Discussion question, just like all 4, will be at the beginning. So there are 2 parts to this discussion question. There's the one that is my absolute favorite of the year, and it really it looks at how does environment we live in impact our needs. I relate it to The Walking Dead. You do not have to do that. There are other options, but I really like that because it helps us to think about Maslow's hierarchy of need and how we progress in a world that's not, everything isn't perfect. No one lives in a perfect world. The ones that we're using in this example are much less perfect than ours, but it really does change what drives us to live. And so, as nurses, we really have to think about that and help our patients prioritize their care according to their needs in the environment they're living in. There's a small little snippet on the bottom of that discussion question. That's the second portion related to service learning. So what I'd like you to do is read and view all the learning material, watch the videos, and related to service learning. Then put into your own words, what do you feel service learning means? What do you think about a course that includes service learning? I just kind of want your gut on that, and it's a little pre-reflection piece there. The third thing that is involved in this particular module is the midterm. So it is posted in ExamSoft, and it covers all material in modules 1 and 2. The password is there. The open and close dates and due dates are there. It is 50 questions, and it has a 1-hour time limit. There is no backward navigation, so once a question is answered, you cannot go back and change it. Once all students have completed the exam, scores will be entered into the gradebook, so you will not see your score upon submission. There's a study guide posted to help you prepare for the exam, and you will want to use that. Again, 60 minutes is not that long to answer 50 questions. So happy reading, Module 2.